Well, welcome back, folks. And this segment we have Dr. John Gerard on. He is with the National Male Medical Clinic. Welcome, sir. How are you?
Hi, good, thanks.
I was commenting on his usage of bow ties, and I know you guys see me in a bow tie now and then. It's great. I love bow ties.
Thanks.
Very nice, very nice. It's a touchy subject sometimes, but I think it's an important one. And what, of course, we're talking about is both testosterone replacement therapy and erectile dysfunction. And you're here to talk about that, about your clinic, what they can do. And first off, what is testosterone replacement therapy?
Well,
and what causes maybe low levels in testosterone?
Okay. Well, basically testosterone replacement therapy is what the name entails. We are replacing testosterone.
Mm-hmm.
And the reason for doing that is because as people age, men and women, but typically we're talking more about men in this situation, testosterone comes down as you age. When you're younger, you get puberty, it goes up, and then it starts to come down slowly. So peaks usually when you're in your 20s, and then it's coming down from there. Some people come down slowly, some people come down more rapidly. But testosterone is responsible for keeping your body strong and healthy. So it's not just for sex drive or things of that nature, but it keeps your bones and muscles strong and other organs of your body working as well, including your immune system, erectile function, and things like that. So if you don't have as much of it, then your body does not have the capacity to repair and restore itself as well as it used to when you were younger. So if we can then restore your level back up to that more youthful level, and we're not talking about 20-year-old level or European German swimmers sort of thing. It's just, a more normal level where you were when you were in your 30s, and kind of keep it in that level on a continuous basis, kind of like taking a vitamin.
Right.
Same
Now,
sort of thing.
besides age, are there other effects that can lower your testosterone, even if you're younger? Medications you take, certain types of diseases you may have, if you have diabetes or something like that. Are those all factors in lowering your testosterone?
Well, they somewhat come into play. Usually if you're younger and you have lower testosterone, there may be other hormonal issues involved or endocrine issues, much more specialized and in depth than the type of patient that we see in our office that just has age-related testosterone decline, which is what most people have, the vast majority of people have that.
So someone comes in for the testosterone therapy, what can they expect?
Well, basically, I never promise people miracles, but most people notice that they feel better, they have more energy, their mental clarity improves, maybe they're not getting as tired as easily, things of that nature, sex drive improves, and then over time you start to notice that your body is improving. Maybe you're a little stronger. If you work out at the gym, you start to notice, hey, I'm getting a little better. My workouts are showing what they used to do when I was younger. If you're having some decline in erectile function, you probably notice that that's improving. Now, if a guy has severe ED, testosterone's not going to, bring you back to when you were 20. But if you have just kind of mild, it's not working like it used to, then you start to see that. And again, most of these effects are over time. So for example, I'll tell someone, okay, we're going to give you a shot today. You're not going to go skipping out the door.
Now, you mentioned a shot. Is that how the therapy is taken, by injections?
Well, there's a number of different ways to use it. There's either injections or a cream that you can use. And both of these are what's called bioidentical testosterone, which means that it's indistinguishable from what is produced by your body, the exact same molecule, as opposed to what some of these athletes and people of that nature use, these other what are called synthetic testosterones that have not quite the same chemical structure as what your body makes, and that's to make them work better for what they're looking to get the benefits out of. Whereas we're just trying to get our testosterone back, just like if you're taking vitamin. I want to take some vitamin C. You're not going to take vitamin C plus, you want vitamin C because that's what you need. So the same thing with testosterone. We want testosterone. So you either get that in a shot, which is once a week or so, you get the shot. Kind of depends on on your response to it, or the cream which you use every single day. And I actually prefer the cream because it gets your level up there and maintains it rock steady at that same level, because you're getting it every single day. With the shots, you kind of go up and down and up and down, and so you start to have kind of these fluctuations. Over time, that evens out, but in the meantime, you're not as stable.
Okay, so the cream is like an ointment in that your skin just absorbs it and it gets into your bloodstream and all a little through that way, and that's something that someone would do at home.
Yes.
Is it safe?
It's very safe. It's very safe. This type of therapy has been around about 10, 15 years, maybe even longer, and much more limited settings. But in the general use, about 10 or 15 years. I've been practicing it about 10 or 15 years, and over that time, again, used the way we were supposed to use it, which is to get the level up to the 30-year-old level and maintain it at that level. We don't really see any problems. People worry about cancer or things of that nature. We really don't see it. And we do some sort of monitoring just to be on the safe side for that. But again, in my experience, in the years that I've been doing, I've never seen any issues with that. People also worry about liver damage, things of that nature. And again, those are with the synthetic steroids, or if you're taking things orally, as opposed to the way that we use it. Really, again, practiced judiciously, you don't see any problems with that.
Okay, once somebody is on this therapy, is there a certain maintenance level? Maybe they get up to that level that you both agree on is working for them. Do they then taper off on the shots and or cream so they can just maintain that level over time?
Well, to maintain that level, you have to continue using testosterone.
Okay.
So it's pretty much a lifetime thing. Now, it's not a lifetime commitment, because if you stop taking it, you're not going to fall apart.
Right.
But you want to maintain that higher level, because that's where you're getting the benefit from it. And again, the best analogy is taking a vitamin. Most people have been taking vitamins off and on since they were a kid. You have to take vitamins because your body does not make them. So the same principle is true with testosterone. Yes, you're making some, but not as much as you need. So to get it supplemented from either the shots or the cream gives you that benefit from it. And if you stop taking it, then your level goes back down to the way it was, and then over time you start to notice those symptoms returning.
Right. Well, I can see why the cream would be a little bit more of a benefit, because you can do that on your own, and then when the time comes that you need another supply of it, it's much easier than always going in and getting a shot every week.
Exactly.
What are some of the causes of erectile dysfunction?
Well, erectile dysfunction, a lot of different causes. Just age is one of the biggest ones. But disease, diabetes, hypertension can be a big cause, and smoking. Smoking is a huge cause of ED. And frankly, I think that if they forget all this warning about lung cancer and heart disease on the side of cigarette packs, if they put smoking can cause erectile dysfunction, I think that would be a much bigger motivator for most people, because I see a lot of that. The heavier smokers, you're going to get ED.
Yeah, definitely. I've even heard that that basically your heart problems can be related to that, and your blood pressure as well.
To
erectile dysfunction, yeah.
Well, somewhat. They used to think, well, the vasculature inside of the penis is sensitive, and so if you have ED, it's an indicator of heart disease, but studies aren't really showing that, believe it or not. It's kind of a different sort of thing. You're not really getting plaque like you do in your heart.
Right.
You're getting just sort of destruction of the tissue there in the penis that causes the ED.
Okay, now when someone comes in, they visit you for the first time, what is the procedure? You sit down with them, talk about obviously how they feel, what's going on in their lives, and then you determine what kind of a prescription that you would give to them?
Yes. Do a complete history, find out how long the problem's been going on, how severe the problem is, what sort of things they've done in the past to address this problem, what medical history they have, if they have high blood pressure, diabetes, heart disease, things of that, what medications they're taking, because certain medications in themselves can cause erectile dysfunction. Certain blood pressure medications, for example, are notorious for that. Do a complete physical evaluation, and then again, formulate a treatment plan for them.
All right, and if you want to contact Dr. Gerard, their number is 800-77-6253, or you can think of that as 800-777-MALE, right? And their website is National Male Medical Clinics, clinics with an S.com, and you're located very nearby on Sand Canyon over in Irvine, right?
Right next to Hoag Hospital.
All right, so not far away at all. So give the doctor a call, and it sounds like he can certainly help you out. Some very good information, and I found it very interesting how when you talk about testosterone levels, how it affects just your physical well-being.
Absolutely,
Quite interesting.
absolutely. I always used to say, if I was stuck on a desert island and I could only have one hormone, it would be testosterone.
Yeah, definitely. Well, thank you very much. Good information, and again, give their number a call if you need some help with that. And doctor, thank you very much for coming on. Hope to see you again.
Okay.
All right, folks, we'll be right back in just a moment.
Start getting your sex life back. National Male Medical Clinic has the alternative to Viagra, Cialis, and Levitra.
At National Male Medical Clinics, we personalize treatment that is fast and easy with no pain or surgery, regardless of your age or medical history. One appointment will change your life.
Our guarantee: if you don't respond to our medication on your first visit, you will not be charged. Over 80,000 men have gotten their sex life back. Call National Male Medical Clinic today